Warm welcome, dear viewers in Health Television. Nice that you are back with us. I am particularly looking forward to my guests in the interview today. We will talk about Hashimoto's disease or Hashimoto's thyroiditis, which is spreading widely, unfortunately, so more and more people are affected by it. And today we will hear from our specialist, Dr. Harald Burgard, a specialist in internal medicine. And his area of expertise is toxopheresis. And we'll see what we can achieve with toxopheresis for this indication. I am happy and I cordially invite you one to follow me in the conversation. See you soon. A warm welcome. First, I would like to greet our guests, our guest via Zoom. With us is Karin Bohner. A warm welcome. It's great that you are here, that you are taking the time, and a continued warm welcome, Dr. Harald Burgard. It's great that you are with us.
Hello, Alexandra.
And yes, we should best start right away, dear Mrs. Bohner, with you. And you are affected, or are probably still affected by Hashimoto, from the thyroid inflammation and also have a concomitant symptom, or rather a genetic predisposition. But I would simply like to hand over the word to you now. If you could just explain to us again what you were affected by, what exactly is going on with you.
Yes, the nice thing is that I actually have to concentrate very hard now to remember my symptoms. Because as soon as everything gets better, it's immediately forgotten. But what is certainly prominent is, well, a constant feeling of fatigue and exhaustion. No matter how much you sleep, you can sleep 3 times a day on some days. And what I specifically experienced is also simply a permanent feeling of muscle soreness throughout my body. And a side effect for me was also that I react very strongly with my stomach. So I have become sensitive. I then had to learn that the immune system doesn't just target the thyroid, but also attacks other areas in the body. And for me, obviously, the parietal cells in the stomach that produce hydrochloric acid. That means I have very little digestive power. And then, of course, it's always the case in nature that one thing leads to another. You don't just have a thyroid issue, you have several problems. And with normal conventional treatment, I have basically quietly become impoverished. I would say it that way.
So the process has continued to evolve. The symptoms have intensified.
So the end was not foreseeable at all. And the pills that you always get, which are indicated as the remedy, well, that means it is not curable according to conventional medicine, but are sold as a solution. They have had no change at all for me. So I take them quite obediently and bravely, but whether I take them or not, I feel completely the same.
What is the time frame? When did this develop so insidiously?
So I already had the diagnosis of underfunction, and then I would say about 2 or 3 years later, the diagnosis of Hashimoto was added. And that must have been about, well, Hashimoto I think has been for about 8 years now.
Okay. And then you were under conventional medical treatment, as you described, which really did not lead to any improvement.
The only improvement that I can tout is that once a year a solo was done, so an ultrasound was done, exactly, and then I was told again how big the holes are now. That in itself is the treatment.
Okay, you have probably also dealt with this topic beyond that. And what other options are there? What have you come across and what else have you tried in the meantime?
As long as it was somehow possible, I pushed the topic away until can't do it anymore and just tried to fumble my way through. And by waiting, it will get better. Unfortunately, that doesn't always work. Yes, and then at some point
Please excuse this brief interruption, but please subscribe to our YouTube channel down here. This not only helps us to spread this program further, but we can give a lot of people more hope with it. Thank you very much and enjoy the program. Goodbye.
This conventional medical treatment has made me react subtly aggressive that I just decided I'm now studying medicine myself by watching YouTube shows, and then I found Mr. Dr. Burgard with you. And then I was completely astonished that you can actually get an appointment quite quickly, and I am so happy. And my husband has, by the way, the same diagnosis, and since then, we are in the process. And as you can see, it has clearly improved.
What did you specifically have then? How did the therapy look? What did you specifically receive or what was done with you?
So I think the main block, Dr. Burgard will probably agree with me, is this toxopheresis, this detoxification measure. And next time I come, I would also like to show him something. You won't see that here in the video. My first toxopheresis was about a good half year ago, and I now have so many new hairs. They are so long.
Wow.
They are all half a year old now. I have a whole wreath around my head.
Wow.
So I never noticed that I have hair loss. I have a lot of hair, but still it was obviously so. And yes, my sleep has improved significantly. And the second part of the treatment is we get a lot, I'll call it summarized, dietary supplements. Individual remedies might not really be a supplement, but they are not traditional medical drugs. The gut rebuilding includes vitamins, minerals, an amino acid, and also herbal remedies that also detox.
Okay. So the conclusion you ultimately draw from all this is that you are now on a good path. Noticeably on a good path?
Yes, definitely. You can see it. So Mr. Dr. Burgard is not someone who leaves anything in the realm of assumption. He regularly checks his work by simply doing tests. And then you can see exactly my uric acid was elevated, my cholesterol was significantly elevated, the triglycerides, the inflammation markers, a lot of different values. And they all move. And they all move in the right direction.
Okay, that sounds encouraging. And your husband is also in treatment, you say?
Yes, he could tell you little about complaints because he doesn't deal with it at all. Even more thoroughly, but his blood tests look just like mine. It's moving.
Yes, very good. Wonderful. Then I think we can discharge you already, because that is actually what one expects, that when one is in a therapy compared to what you have experienced in conventional medicine for years, where nothing progressed, where it actually steadily worsened. That is actually what one would like to hear now. And that's why I want to say thank you very much for taking the time and for sharing your story with us.
I thank you for your work, because otherwise I would never have found the solution.
Yes, great. I wish you from the bottom of my heart that things continue to improve, also for your husband. And maybe you can then tell us in another meeting that, yes, now I am again so and so many steps further, and it has also gotten even better. That is what I would wish for. Thank you very much, and all the best to you.
Thank you so much, Mrs. Wonder.
Thank you. So, dear Harald, it's nice that we now got to see one of your patients and could almost hear the progress from her own mouth, because that is just always more authentic than if you tell it. That's why you always invite patients back. And that is fantastic. You hear the same thing from many affected people with this symptomatology that she has told that one is in treatment, but somehow nothing moves forward. In many cases, it doesn't even stagnate, but the symptoms continue to increase.
Well, in conventional medicine, we basically treat it by merely replacing the failure of the thyroid gland with more L-tyroxine, that is, thyroid hormone. But the disease itself is not addressed at all. And my approach is to look at what burdens the people have that might lead to the disease picture, to diagnose it, ascertain it, prove it, and eliminate it. And then people typically feel better. We just heard that again. And when I met my wife many, many years ago, she also had Hashimoto's. And then I said, come on, let's take a look. We treated it, and I was taking 175 micrograms of L-tyroxine back then, which is a very high dose. And then I treated her, and that completely went away after a while. The antibodies were also gone up to today. That was over 10 years ago. And now, it only needs 100 micrograms, and that is clearly better. That means the thyroid has partially regenerated. At first, I thought back then it might have enlarged if nodules had formed. Then we tested that. But it is flawless, so it can even partially regenerate. Not completely, but still. What's important is that you stop the process. And with the patient, namely Miss Bohner, she had Hashimoto's. She also had gout, she had recurring bladder issues, pollen allergy, and so on. And she also had Lyme disease. And of course, the question was, could it possibly still be there and contributed? And you only find that out by looking at the blood. And the lady has, as she already said, chronic inflammations with various elevated values, sedimentation rate, CRP, and so on. But also the ANA, which show that an autoimmune disease is ongoing, and the value of 1 to 10,000 is very high. She also had a so-called Th2 shift. That means there were pathogens that threw the immune system into a disarray. And when the CD57 antibodies, which are certain blood cells, dive out of the blood into the tissue and thus sink in the blood, then that is always a proof. Warning, there are pathogens. And then we found them in the blood, saw that she had pathogens, herpes, shingles, triggers, and so on. But she indeed does not have Lyme disease. One important insight is also,
Yes, absolutely.
she has increased thyroid antibodies. The body is overall acidic. The metabolism is acidic. She has allergic reactions. And these are things that can be evidenced here in eosinophils and so on. Then she had a disordered energy metabolism. She said she is so tired. I can see that as well in various values. Then a deficiency occurs in energy carriers, ATP, and the patient simply feels she can't get going anymore. She needs a nap, or she is just not performing anymore. And then to say, well, they might be stressed, or they are already too old, that is a bit of an oversimplification, because all of this can be treated. Then she also said she had intestinal problems. Then a so-called leaky gut syndrome was found. That means the intestinal mucosal cells are somewhat pulling apart. And then, of course, toxins, undigested food, food residues, and so on can get between these cells directly into the bloodstream behind it. And of course, the immune system does not allow that and carries out defensive reactions. Allergies, inflammation, and so on. Then much too much histamine, and then also a genetic predisposition for celiac disease. So a genetic defensive reaction against gluten. And what we then, of course, found in the blood cleansing, so in the so-called toxopheresis, is that it had many toxins in it. And the so-called circulating immune complexes are too high. These are things that arise when a foreign substance enters the body. An antibody comes and marks it so that the immune system's eating cells can devour this complex. But if we have a rich menu, we get full eventually and leave the food behind. And the same goes for the immune cells when there is too much of it. So if there are constantly toxins present, foreign substances are present, pathogens are present, which are marked, the immune system can no longer devour them, and they remain. They circulate and cause in turn complaints, inflammations, nerve damage, and of course, they are found to be elevated and are pulled out through blood purification. And what is typically seen in such patients who are heavily burdened is here, we call it sludge. What you see there is dirt in the bag that we have pulled out of the body. A normal so-called eluate, which is what we extract from a healthy person, is as light yellow as pale urine and transparent. This here is full of foam. There is dirt in it. You can see that at the bottom. It is not transparent. It is brown. It is dirty. And these toxins must be removed. And we repeatedly see, the more you detoxify the patient, the more the symptoms decrease. And the patient just said nicely that she feels better. And this will also be proven in the lab that these values improve, that the inflammation values decrease, that they normalize, that the antibodies against the thyroid tissue disappear. Because the problem with Hashimoto is also that when this thyroid inflammation has destroyed the thyroid, it doesn't stop there. It looks for another playground. And that often then is the pancreas. And then all sorts of things can arise: diabetes, digestive disorders, etc. So these are consequences that arise from a multiple burden with toxins, with pathogens, with an imbalance of the immune system, with intestinal disturbances. If you treat these things overall, we call it the holobiome concept. We look at everything, at the own cells, at the gut bacteria, etc. Then the people feel better again. And through the toxopheresis, I relieve environmental toxins. I remove paints, insecticides, herbicides, but also lead, cadmium, these toxic poisonous metals and inflammatory substances, etc. And then the body can regulate itself again, then it can heal. That is not done by the doctor. That is always done by the body itself. But you have to kind of push the mountain of garbage down first so that he can get up again and can heal himself.
Yes, we underestimate that. I believe also always these pollutants that we are exposed to every day. I heard recently we are confronted with about 10,000 different substances in our everyday lives which our body has to deal with.
Yes, so there are now about 350,000 chemical substances that we can come into contact with. But our detoxification is designed for the dirt that we produce ourselves.
Yes, that's true.
And then a little for the rest. But if the rest just dominates, as is the case today, then the people do it. When I started 20 years ago with internal medicine, or 25 years ago, the patients came who had 1 or 2 illnesses, and most of them were elderly people. Today, they come who have 10, 12, 15 diseases, and these are young people, half under 30. That has certainly changed significantly. And then one also needs different approaches. Many things that worked wonderfully 20 years ago simply don't work as easily anymore today. Or only when one detoxifies. I keep talking to orthopedic acupuncturists or also with homeopaths who say our therapies work all the better the more someone is detoxified, because people are so overloaded that it only works short-term or not at all in some cases. And conversely, I hear then, when I talk to such colleagues and have patients from whom I have detoxified, they say, man, once a large part of the mess is gone, suddenly homeopathy and orthopuncture also seem to work again. You might just want to consider looking into what's going on in your body, even preventively, before problems arise. But especially when you are sick, you should look for causes.
Well, in a metaphorical sense, you could also say, I first need to get rid of all the garbage in my apartment, because if I don't get rid of the garbage, then all the decoration I put there won't help me at all. It doesn't get prettier, it just continues to stink and remains dirty.
Yes, exactly. That's where it starts to rot and mold.
We've talked about hypothyroidism now. The viewers always like to comment on what's up with hyperthyroidism. May I ask that question as well?
Yes, so a Hashimoto's thyroiditis, an inflammation of the thyroid gland, usually first goes along with an overactive thyroid. And the more thyroid tissue gets damaged, the more the patient slips into hypothyroidism. A thyroid overactivity can arise from various processes, also from autoimmune diseases, also from toxic substances, etc. Also from toxins, also from acute inflammation, also from pathogens, etc. It can, of course, also develop from hot nodules when the thyroid at some point needed more helper cells. And then nodules form, which when they are hot means that they produce active thyroid tissue. And then the body often slips into overactivity. But with these autoimmune diseases, the more tissue is destroyed, the more one enters hypothyroidism. This can be seen very clearly in blood values. And one has to measure several things. TSH, T3, T4, free T3, free T4. Possibly also check whether the thyroid hormones, the active ones being produced, are being blocked by these various toxins. Reverse T3, for example. This is not seen in the normal TSH. We have all this with the patients. And if there is suspicion, you have to check for antibodies. In Basaltov, in Hashimoto, you have such. There is a relatively rare one, the thyroiditis decurvin. You can only diagnose that by palpating the thyroid, because it hurts when it is active. That's why I always palpate the thyroid from behind in every patient when they come in and let them swallow and see if I feel any thickening, feel any nodules, but also if he tells me it hurts. Because that is very rare. If you don't palpate that, you won't get to the bottom of it.
Yes, okay, all clear. So I just wanted to add that. So even in the case of hyperfunction, a toxopheresis is a sensible measure?
The diagnostics always come first. I would do a diagnostic in the case of hyperfunction, see what the person has. And when I know what is going on, one can decide. Toxopheresis, yes, no.
Yes, but I have now understood that the toxopheresis, yes, really has a large share in the positive development.
Absolutely. Because with that, we can actually take things out now that were not possible before. I have done tens of thousands of chelate therapies. It is a fantastic procedure. But with that, you can get the toxic metals out. And with the toxopheresis, you can also get all the environmental toxins out. The paints, lacquers, coatings, silicones, microplastics, and whatever else. Inflammatory substances, autoimmune, antibodies, all that which has developed and is not broken down, I can pull out with that. And that did not exist before. And in that respect, it is a very nice procedure, especially because it is well tolerated. The people basically go home. They might have a little swelling under the eyes, on the fingers, on the feet, for a few hours, or feel a bit tired on the same day or the next day. But that's it. And in that respect, I also do this with very young people, as well as very old people, with sick individuals, with healthy ones. So those who come for prevention. So there are many application areas, because it's simply very, very well tolerated.
Yes. Harald, tell us where to find more information about you. Where can one find you if one wants to contact you, both as a patient but also as a specialist colleague who might say, oh yes, great, I would like to integrate this somehow or whatever in my field or in my area of activity?
Yes, I am located in Wadgassen in Saarland. You can find me at the website drburgard.de. Otherwise, through a Google search for Dr. Harald Burgard, Wadgassen.
You will find what you are looking for.
Exactly.
Okay, wonderful. Then I thank you at this point for this great case study we have just presented, and I wish you continued success in your research in this area and with your patients. I hope we see a lot more there. You've already brought many patients in the past, because it is simply always more authentic than just talking about it.
Yes, absolutely.
Thank you very much. Until next time, dear Harald. Thank you also to you, dear viewers, for accompanying us through this conversation, and maybe you are also affected. So then, if you are looking for solutions, we hopefully were a source of encouragement today and someone who paves the way with this show. I look forward to you tuning in again next time. Please be mindful, vigilant, and loving to yourself as well. And then I look forward to you tuning in again next time, if you'd like. Until then, goodbye.
Thank you for watching from the Swiss Health Television, QS24. Please do not forget to subscribe to the channel up here, because here you can watch all shows ad-free. But also our YouTube channel to subscribe. This is very useful for us. Here is a selection for you compiled of shows that might also interest you. All the best, until next time, and goodbye.